Barbara Thomas with John Ray Realty, and today I'm at the Physicians and Surgeons Surgical Center, the P&S Center, with the President and CEO, Linda Holyfield. Linda, we thank you for coming today. I know that you have set the bar really high for this facility. Tell me a little bit about what is the P&S Surgical Center.
Well, P&S Surgical Hospital, we're a hospital. And we are a specialty procedural hospital. We have a small focus of services. We do surgeries, we do cardiovascular cases, heart caths, we put in pacemakers and defibrillators. We do pain management procedures.
Well, how do you staff your hospital? Tell me a little bit about your patient ratios, nurse-to-patient ratios, and about the experience of your staff.
We have phenomenal staff. My staff is basically, the clinical staff is all RNs. I have surgical techs in surgery, but we have a 1-to-4 nurse-to-patient ratio on our overnight inpatient beds. We have very strong staffing in all of our areas. Our staff, the average length of experience for the registered nurses here is 15 years. Our turnover rate is 2%, so the continuity of our staff, the care of our staff, and the expertise is absolutely phenomenal.
It sounds experience and excellence, and
that's absolutely.
That's a combination.
I'm a nurse. I'm a nurse by practice, and that's our expectations here. We have a high bar. The hospitalists from St. Francis come right over if we need them to. We have access to the plethora of services, any of the X-ray services, lab services we need right away. We're across the crosswalk from the ICUs, and we have this synergy of complementary services, which I think is a strength to our particular model here.
Absolutely. You know, when we have people who are moving in from another area, or even people that are in this area that may not know what's available right here, it's important for them to know that we have an excellent center that they can come to, not only just the P&S, but the St. Francis Center also. We have every need that you have can be met.
The medical community and the healthcare community in Ouachita Parish, us being, I think, an important part of that, is outstanding. And I've been across the country and been in hospitals across the country, and I always come back home and feel good about what we have here. We have very good certified specialists, board certified specialists. The services that we do have here are top notch in an environment that's caring and friendly, and you're a person and you know people and people care for you, and healthcare is just not technical. You have to have technical things, but you really have to combine the art and the science of healthcare. And we have both of those things here in Ouachita Parish. We're blessed by that.
We are. We absolutely are. I know that you've had many awards. Tell me about some of those awards and what's involved. Why did you get awards?
Well, our philosophy, we've been a hospital for 10 years. We started as an ambulatory surgery center, but we're actually a fully licensed, fully accredited hospital. And our philosophy was to have the most professional staff, the best equipment for our scope of services, and to demand that we meet the national benchmarks. So we use national tools and methodologies, and we're measured by national tools. So, for example, we've been awarded the Summit Award for Patient Satisfaction from Press Ganey, which is a national firm. About 5,000 hospitals use that, and we've been in the top 1% in the country for 4 years.
Amazing.
And that means every quarter for 4 years we've been the 99th percentile of patient satisfaction and patient experience. We're the number one in the state of Louisiana for the clinical quality of surgical services. We have the lowest infection rate in the state. We are 5-star rated in total knees and spine surgery. We're a bariatric or weight loss surgery center of excellence. We just recently received notification that we're being awarded a capstone award, which is a clinical quality award given by Medicare, which represents both patient experience and clinical quality outcomes. Our goal is to provide world-class, yet loving and caring care to our patients and our clients, and that's what we do here.
And I can attest to that. You do. I've been here before, and that is everything that you just said is the environment that you have created. Now, tell me one more thing. I know you mentioned a program that you have that's called Tots for Shots. What is that?
Shots for Tots.
Shots for Tots
is a partnership with the state of Louisiana. It's called a community benefit program. It's an immunization service. And so we've been doing that for a good 10 years. And every Saturday we run a clinic. And it's one of the many things we do for our community. We provide vaccine for $10 a child. And we're linked in with the state's immunization system. And it improves access for these young parents who can't get off work during the week. And so here we are on Saturday every morning with small clinical staff. And there's some Saturdays, especially in the summertime, getting close to school starting, that we may immunize 100 kids in a 4-hour period. But we've been doing that. It's called Shots for Tots. And so the immunization rates, that's part of our community benefit and part of some of the right things that I think we do here.
Well, you're doing a lot of right things here, and we thank you. And we just would encourage anyone who's in our community or who's moving in, know this: you have excellent care right here at the P&S Surgical Center. Thank you for joining us today.